Absolutely. So I'm really excited about Linvoseltamab, which is another amongst the number of drugs right now coming out as BCMA-targeted bispecific antibodies. The drug is quite effective, and I think there's a few really great things that it brings to the plate. So yes, if we look across the board of all the BCMA bispecifics, we see that response rates are generally between around 60 and 80%. Which is absolutely wonderful. There's a couple of things though. One is the frequency of administration of the drug, and the other is the rate of cytokine release syndrome, which in some therapies can be as high as 60, 70, 80, or even 90%. So with this study, we actually looked at two doses, 50 milligrams and 200 milligrams. 200 milligrams is actually the recommended phase 2 dose. And for patients who have reached cycle 24 and achieved at least a VGPR or better, they can go on monthly dosing. So as opposed to the currently FDA-approved Teclistamab, which is weekly dosing, we now have a BCMA bispecific that can go out to monthly dosing, which makes it a lot more tolerable for patients on chronic therapy. The other is the CRS rate. So the CRS rate across the entire study was around 44%, but if you look at the phase 2 dose, the 200 milligram dose alone, it was in the mid to upper 30s, like 36, 37%. So a 36, 37% rate of CRS is really great, and this is really going to help the next generation of approaches with bispecifics, moving them all to the outpatient setting so we don't have to admit everyone. So really excited about this drug, hopefully being filed to the FDA in not too long, and hopefully being approved not long after.